In his 30 years as a pharmacist, Rob Modestino says he's never experienced a drug shortage as bad as what he is seeing right now.
We're not talking about, the rare things that one or two people get. We're talking about blood pressure medication, heart medication, medications that are important to people.
Any additional strain on the system could be problematic, Modestino says, and that's why he's concerned about today's announcement out of Washington.
I think if we do start to supply the U.S., it's just going to escalate that to levels that we're not going to be able to handle.
But don't panic just yet. Any new American plan could take years to approve and implement. Donald Trump's announcement is likely more about U.S. election politics than actually cutting drug prices.
In terms of tackling the issue of reducing drug prices for brand name drugs in the United States, which is a big issue, it's kind of a sad solution, but at least it's a baby step.
Healthcare is such a big issue in the 2020 presidential campaign that over the weekend, Democratic nominee hopeful Bernie Sanders crossed the border into Windsor, Ontario to buy insulin, which sells in Canada for 1/10 the price.
If I were a mother in the States, I would be doing the exact same thing.
Diabetes Canada wants the government to take action and develop a strategy to ensure insulin is protected if this plan comes to fruition. Its biggest concern right now, the U.S. proposal could trigger an unnecessary run on insulin here.
That could be catastrophic. If people started to have concerns about the supply of their insulin, that could have really potentially extremely dangerous consequences in Canada.
Canada didn't get much of a heads up this was coming. The health minister says she's now in contact with her U.S. counterparts and will work with Canadian industry officials to ensure there are no adverse effects here. Katie Simpson, CBC News, Ottawa.
Now let's hear some more on this from a Canadian perspective. Joelle Walker is the Vice President of the Canadian Pharmacists Association, and she is in Ottawa this evening. So let's start with, from your group's perspective, what is the biggest concern here?
Well, the biggest concern that we have is around the availability of medications in Canada for Canadian patients. And we've seen some survey results that show that 1 in 4 Canadians has experienced a drug shortage, either personally or a family member. And pharmacists are confirming that. They're seeing a great increase in shortages that happen year over year, and have seen a tremendous increase in the last 3 to 5 years. So any additional pressure that can be put on the supply chain in Canada is going to be a huge problem, particularly if we're trying to supply medications to a market that's 10 times our size.
So theoretically, I certainly understand that, but realistically, do you think we're going to get to the point where Canadians won't be able to get the prescription drugs they need because of what's happening in the States?
Well, there's been a lot of attention on this in recent days, and particularly with some of the visits that have happened from Americans coming up to Canada. And so there's a bigger spotlight on the availability of medications in Canada. It's maybe a little too early to tell exactly what kind of numbers we're talking about, but some of the states that have passed legislation are substantive in populations. Florida has a population over half the size of Canada. So that even a state passing this could actually have a pretty big impact on the availability of medications for Canada.
And so, in turn, your organization, one of those that signed a letter to the federal health minister, what is it that you want the government to do?
Well, we want the government to come up with an action plan. We think the urgency is sort of more pressing now that the federal government in the United States has announced a bit of their own action plan to come up with some creative and comprehensive solutions to make sure that we're able to restrict exportations of Canadian drugs to the United States and also make sure that we're not creating unintended barriers for Canadians to access things in Canada as well.
All right. Thank you very much for your insights.